Hi, this is Buzz Buchanan, and I wished I knew that diabetes could cause kidney disease.
Hello, I'm Tamara Ruggiero.
And I'm Mike Spigler.
And welcome to the Kidney Collective, a podcast series that gives voice to what it's really like to live with kidney disease. In each episode of this limited series, we'll talk to a member of the kidney community about their experience, including what they wish they had known before their journey began.
Join us for a personal look at what life is like in the Kidney Collective and come away with information and inspiration to help you know how to take charge of your kidney health. Today, we are joined by Robert Buzz Buchanan. Buzz is a fifth-generation resident of San Diego, California, where he has lived his whole life. He was an orthopedic technologist for 30 years and has been retired since 2015. Buzz was diagnosed with type 2 diabetes in 1998 and was later diagnosed with stage 3 chronic kidney disease. He has managed his chronic kidney disease for over 10 years, keeping it from progressing to kidney failure. So, Buzz, I want to jump into the question because I got some information about you before we did this meeting with you. And it said that you are a percussionist in a band, but not only that, you were formerly in a Jimmy Buffett cover band. And as a parrot head myself, I just wanted to ask you a very important question: is what is your favorite Jimmy Buffett song?
Really don't have a favorite. I like more of the mellow, just him and fingers playing that kind of style more than the more party type music myself.
Yeah.
Me too.
Yeah.
Even though when you play in a band, you may play more of the top 40 songs or
right.
Yeah.
Right.
Thanks for talking to us, Buzz. So our first question for you was, I understand that you were diagnosed with type 2 diabetes in 1998. Can you tell us how you received that diagnosis? Did you have any symptoms that made you seek out a doctor, or was it during routine, like a routine physical, or how'd you find out?
So actually I was at work and one of the nurses, I was having a little problem concentrating and doing things. And I told her I wasn't feeling well. And she says, well, let's test your blood. And so she got out her meter and tested me. And I think I was about 280 is for my blood sugar. And I was kind of having tunnel vision. And I'd had these symptoms before, but I never thought about getting tested. I wasn't being tested for A1C at the time. And so anyway, that was my first diagnosis. Looking back, I had type 2 diabetes way longer before my actual diagnosis. So because of the symptoms, when you're having symptoms of diabetes, a lot of times you have to go to the restroom more often. Well, I thought, I need to be hydrated more. So I made the mistake of now drinking Gatorade. That would hydrate me better. And all it did was increase my blood sugar and made it worse. So that was a rude awakening in a sense. And I couldn't lose weight. So that was another thing, that I was gaining weight instead of losing weight. So of course, I wasn't really thinking about it as much because I was burning the candle at both ends. I was playing in the band and I was working full time. So that added to that also.
Yeah. Yeah. How long do you think you might have had type 2 diabetes before you were diagnosed?
I'd say at least 5 years before then.
Yeah.
So I was, obviously what they call pre-diabetic probably. And this seems like the stress brought on a little bit of it. And during that time, I also had a large kidney stone that also, I think, might have contributed to my kidney disease in the long run.
So you were dealing with a lot. And I think we're going to ask you in a minute about the kidney disease, but just in terms of finding out you had type 2, I imagine you had to implement quite a few lifestyle changes after your diagnosis. Can you walk us through sort of how you handled the diagnosis and then the changes that you made?
I handled the diagnosis as just part of my life. It wasn't like I had to start, using insulin and doing injections. I was using just medication at first. And and it was controlled quite easily by medication. In fact, right at the beginning, the medications worked too well. I was starting to get too low of a blood sugar, and I had to cut back on my medications. But I cut out a lot of, tried to cut out a lot of food that I used to eat as far as fast food as much. And didn't, it wasn't, I was never really a big drinker,
Mhm.
um, but I made sure that I cut most of that out. Maybe I would have like 1 or 2 beers every 2 weeks or whatever, but that'd be
Mhm.
it. The big thing that happened is I got to be enrolled in a weight loss clinical trial, and I
Oh,
was taking
Interesting.
they were giving me this weight loss drug and were monitoring me, and I lost, I think about 25 pounds on that program,
Hmm.
and that seemed to help quite a bit. And then since my diagnosis, I've lost a total of approximately 50 pounds.
wow. Congratulations. That's
Oh, that's
great.
great.
So a lot of it's from the trial medication. And then the second go around, it seems like I just kept on keeping my weight down, not eating too much. Uh,
Mhm.
it wasn't like I became a vegetarian or anything. I just kind of watched my portions.
Yeah.
So
Yeah.
When you were diagnosed, Buzz, did anyone say anything to you that, diabetes has a relationship to kidney disease? Did you know that going into it at all?
I did not really know that. The doctor, he'd have me on like I'm not hypertensive, but he'd have me on a blood pressure medicine. And I'd say, well, why do I know I'm not hypertensive. Why do I have to have this blood pressure medication? And he says, we're trying to protect your kidneys.
Yeah.
So he
Mhm.
was, he, and because the long term, they explained to me the long term medication that I would be taking would possibly contribute to kidney disease. And since you had to control the diabetes and the blood sugar, on the other hand, you're possibly harming your kidneys and your liver at the same time. So
Wow.
Mhm.
it's it's a balance. Um,
Yeah.
I had a father that had bad coronary disease, and his doctor told him once when he asked, "Do I really need to take all these pills?" And the doctor said, "Well, not really, but in the meantime, they're keeping you alive."
Yeah. Right.
Well, yeah, and I think it's something that we're really learning the last few years. There's such a connection between the heart and diabetes and the kidneys, and we call it cardio kidney metabolic syndrome for those that have not heard of that. And all of those are so connected. So usually, when you've got one, you've got to do something to try to manage the other. So it's that interplay is really really important.
Mhm.
Yeah, it could have been that my dad did have some sort of a mild diabetic condition, but was never diagnosed.
Mhm.
But I was always thinking that because of my family history, I'd have problems with my heart, and I
Hmm.
haven't never had any really coronary problems. But now I have of course, the type 2 diabetic disease and the kidney problem.
Yeah. How did you take it when you found out that you had kidney disease?
I just took it as mostly part of my life and the progressing of the diabetic condition. That's one of the reasons why the doctor, my primary care, has weaned me off of metformin for the most part. And I'm taking the newer drugs. I'm taking Rybelsus and Jardiance, and
Mhm.
so we're seeing how that's going to help. I do have to take a small amount of metformin still 500 milligram, but he's just trying to keep me in the A1C balance of being below 7. So right now, my last couple of tests, I was right at 7.
Yeah,
So
that's good. That's good for yeah, yeah. You're
they're
doing a
trying,
good job.
well,
Yeah, I know what it's like I mean, I have a very close relative who has type 1 diabetes and is 82 years old and has spent his life dedicated to maintaining that balance, like keeping his blood sugar under control as best he can and doing everything he can to protect his heart, and his other organs, and he really credits being vigilant like that, like you are with his longevity. So,
Yeah. And I just want to call it for those listening, some of the new medicines that Buzz mentioned. So there's two real new classes for people with diabetes to protect them from kidney disease, or if they have kidney disease. SGLT2s and GLP1s are kind of the classes. And I know that's sounds like a lot of numbers and letters, but we've got plenty of information on our website on our Know Your Kidneys page that can point to some of that. But if you're listening to this and you have diabetes, I think one takeaway here, and Buzz is a great example of that, is there are lots of medicines that can help with this now that not only help manage your diabetes, they also protect your kidneys, it also protects you from heart problems too. So it's really important that you're listening to what Buzz is saying and talking to your doctor.
Regarding the medications, I'm just lucky I have a very good medical plan and very good coverage that I can take some of these newer drugs that are actually quite expensive if you don't have coverage for them. So the GLP-1 that you're talking about is quite expensive. Luckily, my copay is reasonably low, but I notice that, when the price comes as a notification, I would never be able to afford that. And I'm okay as far as financially. They really need to get those prices lower for people that have this problem but don't have the resources.
yeah, so many people are struggling with that.
So hopefully people aren't going to get, because they can't afford the right drugs, and then that makes their kidney problems worse because they can't afford the right drugs for their type 2 diabetes. So we'll see how that plays out, but it's another situation.
For those of you that don't know, there are 5 stages of kidney disease, one being kind of the earliest stage, stage 5 being the later stage. You've been in stage 3. For those of you that for the listeners that might not know about kind of what the tests are, Buzz, you want to talk about how often you're tested for your kidney disease, what that looks like when you get it done?
I'm tested for my A1C, and I'm tested for my GFR once every 3 months to monitor that. Once a year, I go see my actual kidney doctor that was referred for this program, and I see her only once a year. But my primary care, I see every 3 months and do my laboratories. So, and everything has been stable ever since I started with both of them. So it's been 9.5 years now since I started with the Dr. Swice, which is my kidney specialist.
Buzz, do you have urine tests done at all as well sometimes?
Yes, that's included every 3 months.
Yeah.
So
And that's really the one, I think, for those listening, if you've been told you have kidney disease or you're at risk for kidney disease and you're not getting that urine test, you really need both tests together. All those tests that Buzz was talking about, urine test for UACR and blood test for EGFR for kidney disease, but especially if you have diabetes, like Buzz says, it's A1C is extremely important. I think we call it's the report card for your diabetes, because it's not like a one point in time. It really shows how well your blood sugar has been controlled over the last few months. So all of those extremely important.
yeah, so I try to use my meter in the morning once a day just to monitor what my blood sugar is when I start the day. I don't do it before every meal or do anything like that. I just do that once a day monitor, and usually it's fairly well. Sometimes it's surprising how what you did the day before affects it. Even your stress level affects it. So that's why you got to really sometimes mentally, as far as the blood sugar goes, you got to mentally talk your way down from being too upset about things that are everyday, daily problems.
Yeah, I'm always sort of fascinated when I talk to my family member who has type 1, and he will tell me, his sugar was high yesterday or low yesterday because of something that he did or experienced that I would never think would affect your blood sugar. And it does. And he just, at this point, he rolls with it because he understands that it's very intricate and there are a lot of factors that go into play there.
Yeah. Sometimes I don't necessarily roll with it, but if I test my sugar the next day, I'm going, oh, that's the reason why.
Yeah.
Um,
Yeah. That's probably a better description. I guess he doesn't really roll with it per se, but he deal with it. And he's like, okay, I'll move forward with it. I wonder if Buzz, so I'm in a lot of CKD stage 3 Facebook groups. And I have noticed in there, I would say one of the common themes in there is fear. People are diagnosed with CKD stage 3, and they don't know what it means for them and their future. You've been able to hold your kidney function steady for years. And what advice would you give to people like that who've maybe just been diagnosed with like stage 3, say, and are concerned?
Well, some people will, I guess, panic regarding it, and
Mm.
um, but you don't necessarily have to have a complete change of lifestyle. My lifestyle hasn't really changed all that much. They say exercise more, do make sure they're hydrated more, things that are kind of normal things to do, but I didn't go out and start joining a gym and going to the gym every day and exercising, light exercise on a daily basis, mostly walking our dog.
Yeah.
And so I just take it as being part of my life. I mean, my dad, he had his first major heart attack when he was only 42 years old, and he dealt with his heart issues and he passed at 79. And he actually mostly outlived all his good friends, and he thought that he was going to be the first one, and he ended up being the last one in a sense. So I don't think you can panic too much about it. It's part of your aging process. It's not that everyone's going to get kidney disease. Not everyone's going to get heart disease. I'm really pleased that is not like, something else that is like a cancerous situation. Uh,
Hmm.
so it's something that I can, at least with medicine, it kind of catches up to what your problems are. So with my dad, it seemed like every time he had another situation with his heart, there was some medical discovery that had happened, and he could take advantage of that. Kind of like with his type 2 diabetes and the kidney disease, as I've progressed, also medicine has progressed. So,
Yeah.
I mean, you can't really necessarily panic about changing your entire lifestyle. For it's a condition that you have to kind of control and monitor, but you have to live with whatever life throws at you.
Yeah, I think that's a good philosophy. And I think, one of the main messages we try to get out to people who might be listening to this who have like CKD stage 2 or 3, the progression can be slowed or stopped in many cases. And I think that sometimes there's that fear that, oh, I've been diagnosed with CKD. I'm on this inevitable slope to kidney failure. And that just doesn't have to be the case. And so we're working to help people sort of come to terms with that and understand that. I think your experience is a good example of that.
Yeah, that's what it's good to have good physicians following you to also that understand your problems. I wouldn't necessarily want to take medicine every day, but I know that I have to take it every day just to keep this level and to keep it going. So
Exactly.
I've had lots of friends that now I'm 73 now, so I'm in my later stages, and unfortunately, you have friends that have passed because of certain conditions. Diabetes is a couple of friends have died from they were type 1 or they type 2 going to type 1 and then they passed, and it was because they didn't wanna deal with it anymore, and so they didn't really control themselves, whether, be from not doing their insulin correctly, just didn't wanna deal with it, so
Yeah.
Yeah.
I think it gets overwhelming for people, and I think if you just get in kind of a bad mental place, then it's really tough.
and if you don't have good, coverage, medical coverage, and you're struggling
100%.
because of they're pricing you out of the system as far as your pharmaceuticals, it's really hard. Then you are in a struggle because it's they talk about the people that either buy their medicine or they pay their rent. What do they do? Are they out on the street or are they, you know, then they
Yeah.
can't afford the medicine either. And once that happens, that's where dire straits happen. So
Yeah, I think that's a really important point. I mean, let's, think about people who are, struggling to control their diabetes. They many of them, like you're saying, facing a lot of uphill financial battles, health coverage battles, don't have the optimal medical care like you've had, and they're just doing their best. And so I think that's a really important point for people to understand.
But I think people that do have good coverage, they need to use it and to keep themselves monitored and keep themselves on the right path. You can fall off the path and it's okay. But yeah, just get back up on the path and just trust mostly what your physicians tell you. Because the key is to have good physicians in the first place. So sometimes people, even if they can afford it, sometimes they skimp on better coverage and lesser medical coverage, and just because it's a few dollars less a month. So they need to have good physicians. We're very lucky here in San Diego. There's like 4 systems of medical care, from the military being here, VA being here, the University of California being here, and then there's 2 private organizations based here in San Diego. So it's just because of the competition, and also being in San Diego, it has a little bit of attracts the physicians that want to come to Southern California to live here. So
Well,
Yeah.
your weather is so bad.
Pretty
So, I
nice
mean,
place.
yeah.
So, it is a good factor, because we've had friends that have moved and then maybe they don't have as good medical care that we are provided with. So
Yeah.
Mm.
Buzz,
we've been very lucky.
one question for you. You have a really strong medical background. I mean, you've lived with your dad with medical challenges. And just listening to how you're taking charge of your health, I mean, you clearly sounds like you can understand the kind of medical lingo that's coming at you and have confidence in talking to your doctors. Being in the medical field, what advice do you have for a patient that's just doesn't have that same level of confidence in understanding some of these things? What advice to kind of get the answers that they need?
Well, I think listening to a program like yours and finding out more about what's going on with your particular condition is important. I mean, being an orthopedic technologist, we used to deal with a lot of people that were diabetic, that had diabetic conditions, diabetic neuropathy, diabetic sores, and such, that they had, quite frankly, they had to have amputations and to take care of their problems orthopedically. So I I got a real, down to earth education regarding these conditions before I was ever partly diagnosed with anything. So, I saw people go through those struggles orthopedically with their conditions. So it kind of wakened me up, but it's not something that I don't think you need to necessarily fear. It's something that you need just to educate yourself with as much as you can. I don't believe I'm fully educated regarding my problems, but I try to, at least, if I have a question, I try to ask the appropriate person, my primary care or Dr. Swice, my kidney doctor. So, and, you know, it's just something that you just learn to deal with that. But
Uh-huh.
in being orthopedics, and we deal with all these injuries that people can get over in 4 to 6 weeks. But, you know, those injuries would happen, they'd get better, and they'd move on. Where, for a chronic condition, you don't just move on. But we dealt with chronic conditions also. So
Mhm.
it was, there's a little bit of a difference. This is
Yeah.
a chronic condition, and you're not going to get, it's not like you can take medicine for it and you're going to be done with that portion of your life. Your broken arm, okay. Yeah,
Yeah.
it's done unless you break it again.
Yeah,
So
that's the thing. It's a chronic condition, but you can live with it and you can live a long, healthy life with it, right?
yeah, I
Yeah.
plan on I plan on living way longer. I keep on kidding all my close friends. I go, you know, I want to be like my dad. I want to be the last one.
Yeah.
So
Yeah.
that's why I want to take care of myself, because I want to be the last one. So
Yeah.
that's, I'm enjoying my life as it is. I'm enjoying my retirement. I'm enjoying being able to travel, being physically able to get on airplanes and go to places. Whereas I have people I know, and even same old classmates and stuff, that they can't do that anymore, even at our tender age of 73. So,
Mhm.
and it is a tender age in a sense, hopefully.
Yeah. Yeah, exactly.
And so, nothing you can get, you can take that magic pill, but there's nothing you can do instantly. It's all, it all takes time. It all takes time. I didn't lose my weight in 2 weeks. I lost it over a long period of time with the help of my wife and the help of my physicians. And I think that actually has been the best thing for this disease that I've done. The medicines helped me lose the weight, but it's also losing the weight. I mean, I could have just said, forget about it, just not even tried. So
Oh, yeah. I think weight loss, especially of the amount that you lost, has so many positive health benefits and really just transforms your life in many ways.
that's why when the university offered me programs in trials, took on these trials,
Mhm.
just for the fact that the worst that was happening is nothing. The only thing it cost me was time. So time to go to these appointments, and time to take what the tests they needed to take. So
Exactly.
I was also in a study recently that they were correlating diabetes with fatty liver disease. And
Mhm.
where they thought at one time I might have had a fatty liver, this study says, no, you don't have a fatty liver. So that's not the reason why you got type 2 diabetes. And they were trying to figure out if that was the case, would that be an easy way to diagnose or pre-diagnose um, someone uh, getting type 2 diabetes, was if they had what they thought were fatty livers. But
Yeah. I
but
just have Buzz, I just have one last question for you, and
sure,
it's sparked by you talking about being in the clinical trials, and then we'll wrap up. But I'm curious what you would say to somebody who's thinking about being in a clinical trial.
I think that it's important that people do clinical trials, just for the fact that it's going to possibly help them, but also help others down the road. Nothing happens unless someone volunteers to do these trials. And it's important that these trials happen, because that's the only way things advance. You can have the laboratories trying to figure it out, but until you actually use a clinical setting to figure out if that really, really works, there's no reason they can't implement it and things won't get manufactured. A lot of these medicines now wouldn't have ever happened without some kind of clinical trial. I mean,
Uh-huh.
the vaccines that we've gotten, the GLP drugs, I mean, they were trying all kinds of other drugs before the GLP drugs came along. Um, so my wife was actually in a clinical trial for another medication that uh, didn't pan out. I was in that clinical trial from the medication that I was taking never came to market because it didn't. It worked a little bit, but not as well as it could or should work compared to what might have caused in problems down the road.
Oh,
So
okay. Yeah.
and but they have to do those things in order to do. So I think you know uh, clinical trials are very important.
I would also say for anybody who's, listening, Mike, you can give the details on this, but our website has the clinical trial finder, so you can plug in your information and find relevant trials.
Yeah, absolutely. We have a partnership with a company called Antidote, and they have simplified it because if you go to the government website, clinicaltrials.gov, it's a lot of very scientific talk. And you put in diabetes, you're going to get 8,000 different trials coming up. So this really, you put in kind of some basic demographics, and that limits it down to the ones that you're really qualified for. So we certainly would recommend that too.
Well, the thing is too about the clinical trials is you might find out something that may have helped you down the road, that you didn't even know was going on. It's kind of like, in a sense, free medicine.
Yeah. No, that's true. Absolutely.
Thank you. That was a great conversation. Really appreciate you doing that.
Yeah.
Oh, you're very welcome.
You can now add podcast guests to your list of accomplishments. But Mike, I think this was an important conversation with someone who has, I think, what we would think of as the most common presentation of chronic kidney disease, right? Type 2 diabetes that eventually damages the kidneys despite their best efforts to manage their diabetes.
Yeah, absolutely. I mean, it causes, almost 1 in 2 cases of kidney failure in the United States. So it is a big problem for type 2 diabetes, but also type 1 diabetes too. But, his case is so typical of the diabetes epidemic that's in the United States right now, which then leads to the chronic kidney disease epidemic.
Yeah. And I think in the case of somebody like Buzz, the CKD generally advances slowly, and there are steps you can take to slow its progression, which you talked about a lot in this episode. I think when we hear the word progression, that's a word we talk about a lot with regard to CKD, and I think that can be a confusing term because progression is usually thought of as positive, but when it comes to CKD, it's not positive.
No, exactly. I mean, there's a lot of words I think that get used in healthcare and medical lingo that really misleads people, but you're 100% correct. I mean, it is not progress. You take that progress part of progression is actually the opposite. And even though, like you said, it's very slow, it's something that has to be dealt with and managed. And, at least fortunately now, and Buzz is a great example of that, there are a lot of different medications and treatments and lifestyle changes that can be made to, what used to be, you would hope to maybe slow it down. But really with some of these new medications that are out there for people with diabetes and kidney disease, not only does it protect like the heart and some of the other things that people are dealing with, but you can, in some cases, actually just stop the progression completely. So it's really important to know that you're at risk for it and get tested, because now there are so many things that you can do.
Yeah, exactly. And one of my favorite things that he said was, don't panic, right? If you've been diagnosed with CKD, don't panic. I think that's important for people who are diagnosed at any stage. I think it's overwhelming to receive a diagnosis like this, especially if you're not familiar with kidney disease. What are some of the resources you would recommend for people who maybe are recently diagnosed with CKD? These are people who maybe are not close to kidney failure. They're overall doing pretty well with their health, but they just need to know where to go for information and maybe what steps they should.
Yeah. Well, I think there's a couple of different things. I mean, certainly, this is a hallmark of our Kidney Action Week that we do every March, and you can already see lots of some of the archive sessions we've done on the early diagnosis of chronic kidney disease. And I think you'll hear from patients and doctors who have been through this and dealt with that. I think our Know Your Kidneys website, where you can plug in your numbers and kind of get some questions to ask your doctor based on what stage you're in right now. And then there's a lot of organizations and websites outside of AKF too that can help you kind of think about, okay, well, it's one thing if you're diagnosed with stage 2 or stage 3 and you're in your 80s versus that you're 20 years old, and really understanding what your risk of it getting worse and getting towards kidney failure is important. One website that I would recommend and a tool is something called the Kidney Failure Risk Equation. So you can actually put in, some of your typical numbers with some other things about yourself as well. And it'll really give you that kind of prognosis, for lack of a better term, for, your chances of going into kidney failure, because that's what you want to avoid. Kidney failure is dialysis, transplant, and unfortunately, in many cases, some patients' death. So, you really want to kind of understand where you are and know what steps you can take, because like I said earlier, there's so many options for people now.
Yeah, and I think we'll definitely want to drop that resource into the show notes along with the other resources you mentioned.
Absolutely.
And then I guess my final thought was the question of getting to the bottom of what really caused your CKD. Buzz, in his case, is pretty confident it's from type 2 diabetes. I think that's been confirmed. But as we know, a lot of people do need to find out what really caused their CKD.
Yeah, because it can be, the one thing is you can have diabetes, but you might also have a rare kidney disease. I mean, diabetes is so prevalent that if you've got something else going on there too, you really need to treat both of those things that are causing that. And again, our Know Your Cause site, which I think we've mentioned in some previous episodes as well, is a really good tool for not giving you a diagnosis for what caused it, but at least kind of helping you get the right kinds of questions based on the answers that you give us to talk to your doctor about getting that important step of understanding the causality of your kidney disease.
Yeah, exactly. Well, I hope everybody enjoyed the conversation as much as we did, and we're looking forward to seeing everybody else for our next episode of the Kidney Collective. To find out more about the topics we discussed in this episode, or to access resources to learn more about kidney disease, go to the episode show notes on your podcast listening platform or go to kidneyfund.org/podcast. And if you haven't already, be sure to subscribe or follow the Kidney Collective wherever you listen to podcasts, and leave us a like or review to help us reach more members of the kidney community.
You can also follow AKF on all major social media platforms, including Facebook, Instagram, TikTok, Blue Sky, LinkedIn, YouTube, Twitter, X, or whatever comes next. Join us next time. Remember that even in the toughest moments, there's hope ahead, and the Kidney Collective and AKF are here for you now.